Hi, it's Dr. Andrew here. I'm a cosmetic medicine doctor from Perth, Western Australia, and I'm going to share with you my 4 top tips for getting the best out of your Beauty Booster treatments. Beauty Booster is the name that we give to injecting the Teoxane Teosyl Redensity 1 into the skin using the V2 injector. It's also called microfiller. Some people call it the Korean Beauty Glow. And I guess it's also a type of mesotherapy, but it's a lot better treatment than mesotherapy. So how do you get the best results with this treatment? Alright, first thing is that you really need to make sure the client gets the right dose. You need to have 3 mils for a full face, and you need to do it 3 times about a month apart from each other. If clients just buy the one treatment or they only get the 1 mil, they're not going to get the right dose, they're not going to get a terrific result, they're not going to fall in love and keep coming back and buying it. If you want your clients to be happy, make sure they get 3 mils 3 times. And the only way to do that, or the best way to do that, is to sell it as a package. And so your price is going to be a lot better to buy the 3-pack than it would be to buy the 3 treatments individually. Tip number 2, you've got to make sure your patients are comfortable. If without any numbing, it's a really quite uncomfortable treatment to have. And if your numbing isn't very good, of course your clients aren't going to enjoy the treatments. That you're going to see the discomfort, they're going to squirm, they're going to ask you, is it over yet? It's going to be much better for your client, much better for you if they're comfortable. And to do that, you just numb them properly. And so in our clinic, we get people to come in early. We dedicate a separate room and a separate team member to apply the numbing, and we make sure the numbing is on there for a good 60 minutes. So the third tip is to decrease the size of the bolus of each injection. So a lot of guides and a lot of people teach to do the 30 microliters per injection. And the great thing about that is it makes it a really quick treatment. The problem with that is that those boluses are really very big, and so your client will go home with quite obvious raised big bumps on their skin. And it is uncross-linked HA, so it will go away. But if you do the 30 microliter bolus, it will take many, many days for it to go away, and they're going to be shy of coming back because they're worried about the downtime. The downtime doesn't need to be that much. If you do a 10 microliter bolus with each injection, you've got to do 3 times as many injections. The treatment takes longer, but the client will have a much better time, and they'll be back to their normal activities and social activities much quicker, and they're going to be very grateful, and they're going to be more likely to want to do future treatments. So tip number 4 is to make sure you connect everything properly to begin with. That way you're going to avoid product leakage during the treatment. One of the biggest complaints that I hear from my colleagues when they try and use this machine is that they get product leakage. It interrupts the treatment. The staff that they delegate to do the treatment ring them up and say, hey, this is not working properly. A lot of guides on how to do this treatment tell you to place the multi-needle into the injector device and then connect the syringe. The problem with that is that you can't connect the syringe to the needle with enough force for it to grip properly. And so if you can't get that to grip, very often it can leak. So if you want to avoid the product leakage problem, make sure you follow this sequence of steps when you're connecting the machine before you start. First up, you need to put the Luer adapter and screw it tightly into the Redensity 1 syringe. Once you've done that, place the syringe using the Luer slip into the back of the multi-point needle. It's really important that this connection is nice and tight, so grip both the syringe and the needle firmly while you push them together. Once you have the syringe, the Luer adapter and the multi-needle all connected in one piece, place it together into the V2 injector. Make sure the red O-ring of the multi-needle is going into the suction port. And when it's placed correctly, you'll see the flange on the Luer of the multi-point needle is seated properly. These tips have definitely helped my staff do the Beauty Booster treatment more successfully and sell more treatments, and I hope they help you too.